Again, I want to reiterate there will be more demand for the vaccine than the state has supply. With the expanded criteria we are announcing today, I continue to ask Georgians for their patience. Given the steady increase in vaccine supply and the significant progress made in getting more doses administered, today we will be taking another step to protect the most vulnerable and get Georgians back to normal. Starting March 8th, we will expand the current 1A+ vaccination criteria to cover more high-risk Georgians, including adults with intellectual or developmental disabilities and their caregivers, as well as the parents of children who have complex medical conditions. Many of the parents or caregivers of these Georgians have reached out to me personally, to my office, and to the Department of Public Health. Many have had to stay sheltered in place for months on end for fear of infecting their loved one or spreading the virus themselves. I have read those stories. I cannot imagine what they have had to go through. Marty, the girls, and I continue to pray for these families. Additionally, I believe it is vitally important for more Georgians to return to normal. For too many parents, this is simply impossible to do while your child is home learning through a screen. Virtual schooling is leaving too many children behind, and parents are literally at wit's end. They are also very exhausted. We must have every student back in the classroom 5 days a week, statewide. To ensure that happens as quickly as possible, effective March 8th, pre-K, K through 12, public and private school teachers and faculty, and the Department of Early Care and Learning educators and staff will now be eligible for the vaccine. We cannot say thank you enough to our teachers, school staff, administrators, early childhood educators, and countless others who have persevered through these truly unprecedented times. The vast majority of these hardworking Georgians have been in the classroom since last fall, and I appreciate the school systems and early learning and daycare facilities who have adapted and put interests of their students and children first. Whether in person, hybrid, staggered, or online only, each local school system did what they thought worked best for their communities. And as a local controlled governor, I respected that decision. But moving forward, we cannot delay full in-person learning any longer. Our children cannot afford to wait until fall. The costs are simply too high. Georgians deserve to return to normal as soon as possible, and that will not happen without schoolhouse doors open for face-to-face instruction each and every day. For the next 10 days, educators, school staff should work with their administration to ensure their district or school has been in contact with the State Department of Education and the Department of Public Health. This partnership will help ensure systems are able to identify and coordinate vaccinations for interested school staff quickly and efficiently. Finally, later in the month of March, provided that the supply continues to increase and the March 8th expansion goes well, we will plan to further expand vaccination criteria to include more Georgians with severe underlying health conditions who are not currently eligible as seniors over the age of 65. We will be finalizing that timeline and the Georgians affected in the coming days. Let me again recap. Effective March 8th, the following groups will be eligible for the vaccine: K through 12 educators and school staff. This includes both public and private schools. Pre-K and DECAL educators and staff. Adults with intellectual and developmental disabilities, as well as their caregivers, and parents with children who have complex medical conditions. This population of approximately 1 million Georgians will join the current 1A+ population of roughly 2 million Georgians. To avoid confusion regarding phases and what different states and the federal government are labeling each population, we will not be using 1A+ or 1B for new expanded criteria. To ensure it is simple and easy to understand, Dr. Toomey's team will be listing those who are currently eligible as we move forward with expanding criteria. The Department of Public Health will continue to work with providers to ensure their criteria is up to date and will be followed in the administration of the vaccine. I'll close by saying this: Georgia will get back to normal. We will protect the most vulnerable, and we will beat this virus. These vaccines are a miracle of modern science that will get us back to a regular way of life, and we will utilize every state resource to ensure anyone who wants to be vaccinated gets that opportunity as soon as possible.